That's as far down as it goes. A chiropractic table is supposed to be to the level of your knees. And you're saying for a massage therapist,
it should be level with your fists. So you should be able to comfortably rest it with your fists. Okay. So I might be tall enough. Okay, yeah.
oh, you go on your knees?
Yes. Okay, so I lock into my hips.
Okay.
And then I rotate like that around.
With your fists?
With my fists, yes. So when you lock in, you get that.
Oh, I see. You're going around with the
Yes.
oil.
Yes.
Okay.
Exactly.
I just kind of like hold on to the wall and like. All right. What is your chief complaint then?
Low back pain. My SI joint has been out for about a month.
Right. And explain to me again how this happened. What were you doing?
So I was in class. We were moving a heavy mannequin dummy. And
Is this the EMT
yes.
class?
So we were in the EMT class. We were moving a heavy dummy. I had like the torso, and I had him under his arms, and then another girl had the legs, and another girl was holding the arm originally. But as soon as like we picked up to move him, she dropped the arm. I stepped on the arm, and I tripped forward, and caught myself on the table.
You fell forward?
Yeah, and like caught myself like that on one of the chairs.
Okay.
And then
So no twisting involved?
Yes, because when I stepped, I tripped on him and I twisted like that.
Okay.
I was fine for most of the night, and then I probably did that at like 12, and then by 6, I started getting tight. I tried to stretch it out. It got progressively worse. I got in the car to drive home, and I kind of rested like that in the car to drive, locked back into place. It started spasming, and
I kind of noticed that's how you were sitting too.
yes, that's how I keep sitting everywhere.
That's how you feel most comfortable is leaning to your left.
Mm-hmm.
And you twisted to the right.
Yes.
So you're it sounds like a strain, sprain strain.
Mm-hmm.
You tore probably some soft tissue. Did they take any x-rays of you?
Yes, the DO took x-rays and he said everything looked fine.
Okay. And so nothing broken, nothing.
Mm-hmm.
And then any pain down your leg at all?
No, just tight muscle in the back of the hip.
So go ahead and turn and face the window. How far down?
Just to about here.
So you're feeling it into here though?
Yes.
And then
I actually have like touch tenderness like back here.
You have a lot of guarding. Your whole low back is just guard. Yeah, it's all swollen on the left. Oh man. You said you had a rib out of place. Wait, don't tell me. I'm like, hold on. Oh, well, there's one. What number is that one? 88. 89. See, I feel this right here.
Yeah, it's
But where are you feeling pain?
right in here. It feels like if I take a deep breath, it's gonna pop, but it doesn't pop.
Does it radiate to the front?
Mm-mm.
So if you would it hurt?
No.
No. Okay, but it feels like it's gonna pop.
Yeah, and if I like rotate my shoulders back, I can feel it in there.
Oh, okay. Scapula feels fine.
Yeah.
But when you say you bring it back, show me again.
Like if I bring it back like that, it's like right in here.
Take your arm and place it behind your back like that. Does that make it worse?
No.
And then place it over your head. Does that make it worse?
No.
So only this here?
Yeah, like if I like move it back like that.
Go ahead and do it one more time for me. And you feel it right here.
Yes.
Oh yeah, there it is. Okay, relax, relax, relax. I see it now. Yeah, this is a huge lump right here.
But I don't know if compensating like this and sitting like this is...
You're wanting to lean in. All right, let me check your posture real quick.
Okay.
Just turn that way, face that way for me again. And which leg did they say was the short one? Okay. We'll find out in a second. Hips, I just see that you're leaning to the left pretty balanced though overall. Yeah, you got the left high shoulder, you know, classic. A lot of trigger points right there, my God. Whoa.
Oh, yeah.
They're on both sides. That's like, how many inches is that on? Like a good 3 inches across. This side isn't as bad. This side is only, I mean, it's there, but it's tiny. It's only about that big. But go ahead and roll your shoulders back again. Oh, it's a little north right here. That's what we gotta fix right there. Okay, you can relax. Does that hurt you?
No, not too bad.
Do it again for me. Right there. Okay. She doesn't have it on this side, but she has it over here. Okay, and then I want you to cross your arms and come back a little bit for me. Does that really hurt?
No, it's just like it's tight and it feels like it's about to pop.
Right
It's
here?
just- yes.
Okay. Well, I did put like a little bit of a fulcrum in there, and it made it worse. But this here, oh my goodness. I mean, I think this leads all the way down into here. Yeah, this whole thing. Can you see that on the camera? No? How swollen that is there? Wow. It's not the QL. Does it hurt a little bit here though?
It's just like tight when you go in towards like the
spine?
sinus process.
Okay.
Yeah.
It's right here that it pops?
Mm-hmm.
Go ahead. Okay, it was the left-hand side, right?
Yes.
Yeah, right at the base here. That's
Yeah,
not too
and that's
bad.
pretty like point tender.
So maybe there's some fluid in here. When was the last time you had a massage again?
It was on the 29th of October.
When this happened?
Mm-hmm.
Oh. All right. I'm just figuring it out, yep. This is where your nerve exits the spine. So that's where I like to run in this gutter here. Then we got these here. Is it still tickling?
Oh no, it's good now. It's tender now.
We got past the tickling. I was like, okay, she can take a lot. Yeah, when somebody says it tickles, it's like, oh, let's go harder. I know. Now I'll go through the vertebrae. Okay, we cleared out a lot of the edema. Here's your occiput in C1. There's C1 and C2. Go down C3, C4. Now I'm on the joint. Left side is clearing out pretty quickly. The right side is going to give me a little bit of trouble. What you'll find is a lot of people are tender here at C1 on the right, then you come up into the suboccipitals on the left. And they'll be all tender up in here. This is the compensation. Subluxations, you can minimize them, but you're always going to be battling them.
How can I minimize them best?
Taking, like we said in the beginning, take it back to neutral. Taking your body back into neutral. And the taller you are, the harder it is. Because guess what? Everybody's shorter than you. And you're looking down at pretty much everybody.
All the time.
All the time. I mean, my brother's 6'4", and I don't think I ever see him look up to talk to anyone. You know, he's always looking down. And he has a couple friends that are taller than him, and I'm like, you look so weird like that, looking up, you know, because I've never seen his throat. You know, you never look. My point being is that like, it's a struggle. The taller you are, the struggle is real. That's why I'm taking you back like this into hyperextension, Okay, trying to put the cervical lordosis back in.
Mm-hmm.
If the joints don't want to cooperate, I sit here and wiggle them. Because doing this all day long, whew, I know you know. Okay, let's see, go down. Here we go, in that gutter. Wiggle, wiggle, wiggle. That's it. You were saying my fists. It's like, oh, yeah. Like when somebody's really tough, I'll dig. But I don't feel like this is necessary for you. I feel like you don't need that amount of pressure. This is good.
I'm digging.
No. But like, you don't have like that thick piece of flesh that you have to work through. This is enough. I'm cutting right through it. I'm gonna go straight to the bone if I use my knuckle. And that's not necessary. We don't need to do that. Okay. Very good. You ready?
Yes.
Here we go.
My ears crack all the time.
Your ears crack?
Yeah. Well, they're not gonna. They just fit.
Oh, did I crack your ear?
Yeah.
I can do that too. Okay, here we go. Chin back for me though. Yeah, perfect. That's all that is.
Nice.
How was it? Not bad.
Amazing.
Now we gotta go the other side. This side is the easier side. Usually I try to get the hard one out of the way first because sometimes you guys only give me one shot. So I'm like, let me get the bad one out of the way first. Oh, I felt it.
Yeah.
I felt the ear. Yeah, okay. Chin back for me though. Right here. Very good.
It's nice and loud in my ears.
Was that loud enough for you? She's like, I want to hear the noise. Oh, yeah, okay. We're just going to wait for this to drain. Perfect. I'm going to hold it there. There you go. Oh, you got socks on. That's right. Toes. So you want me to kind of see. This, you know why I do this? And I kind of want you to keep a curve in your neck. I'm sorry. So I'll go up here.
You're fine.
I'll go up here and talk to you. The reason why I do the feet is because it gives me one, information about how you're placing your weight, and two, it's proprioception. Don't you think your feet could tell you, right? If I close my eyes, my feet tell my cerebellum where I am in place. So if I don't get that right, I feel like it's just like above, down, and inside out.
Yeah.
Pretty good. Now, which was the foot that you said you like? It felt good to pop. This one.
This one, yes.
There it is.
Oh, yeah.
That's what you meant. So why doesn't it do it on this side? Let's see. Oh no, it did.
Update.
Update. Yep. Does this hurt your low back?
No.
Okay. All right. Here we go. Any pain in your low back?
No, not on that side.
Okay, here we go. I'm gonna pull. Very good. That was your hip. That's such a cool the way it looks, Linnea. You gotta film that. You watch it right here. She's really flexible, so you'll see it. It's gonna happen right here. You'll see the hip pop.
That's such a weird feeling.
I mean, I knew I could do that to you, so I did it. I don't do it to everybody, but all right. How's it feeling so far?
Good.
Okay, we're gonna go face down. This is my non-crinkly face paper. All right, here we go. Oh my. It just gets worse when you're on your stomach. Sometimes it looks better, when somebody's laying down.
I
But
have a sports bar on, and I'm comfortable with it if
You
that's
want-
easier.
You know what? The green roller, people's skin can't take it.
Okay.
So I usually do the green roller first, and then we can take that.
Okay.
But thank you. Because look at this thing. Oh man.
I can feel it.
It's really out on the left. Here we go. It's right here. Deep breath in. All the way out. Breathe. Oh, that is still there though. Deep breath in. All the way out. No, I don't think I can do it, huh? That's too tender. Okay. Breathe, breathe, breathe. Yes. The DO was, or nothing has changed since the DO because your left leg is still short. You were so flexible. Just like, wow. Like that. Look down. It still left is shorter, but as I go forward, it continues to get longer. Now this is the anterior side. This is definitely the posterior side. This is stuck over here. And that's the side that pops.
Yeah.
You know what? You know what though? It was only popping here.
Okay.
It's not popping here, and this is where it's jammed.
Oh, yeah.
This is the open side down here, and it's jammed over here. Watch. Can you get like leg heights? I'm gonna raise her legs up. You have a sacral apex to the right, which 80% of the population does have. Okay, it's not like it's a big deal. I say these things and people are like, oh my God, I'm gonna die. And I'm like, no. Your organs aren't symmetrical. Your spine isn't symmetrical. All right, lift the leg up straight as high as you can and down. No, here's the bad leg, be careful. Go ahead. And definitely not as much, okay? Is that painful?
No.
Okay, and we're gonna stabilize the lumbar spine. Go ahead, right leg. Yep, down, and this one. There's a definite decrease in height. Notable 6-inch difference. They say, only 6 inches is significant. Okay, so yeah, her sacrum is deviated to the right. Whoop-de-doo, we knew that just from her posture. This is what's bothering me right here.
It's definitely tender.
You have very prominent transverse processes, though.
Yeah.
Have you been told that you have like a lumbar rib?
I've been told I have an extra lumbar. I've been told I have a 6th.
Okay, maybe. Oh, yeah, 1 here. Here's 6, 5, 4, 3, 2. Any pain when I'm going in the lumbar?
No.
But where is the pain when you?
Like point tenderness?
Yes.
It's down here.
Down. Okay.
Yeah, like right over.
Out of the SI joint then.
Yes.
Okay. So nothing here in the lumbar. Like, see, that feels pretty bad to me, but.
No, it is. When you were putting pressure on it, it was definitely tender.
Okay. Yeah, it just feels really prominent, like it's in a spasm. All right, I'm going to finish adjusting it all the way out. Oof. The pop is just the beginning. Let's put it that way. Deep breath in. Oh, uh-oh. Oh, no, I got to press hard. I'm sorry. I might wait for it, but no, I didn't. Doing okay?
Yeah, that's tight.
Too much?
Little.
Okay. Might have to do the soft tissue work first. I can back up. Still too much?
It's just really tender.
Yeah, look at that though. My goodness. All right. How about just pressure? No? Down the second one. Actually, fourth one. I don't know if I can handle the green roller. Maybe. Because that's pretty bad. It hasn't gone away, like it's still in a spasm. Deep breath in. And on the exhale, I'm going to push. There you go. Oh, man. I'm sorry.
No, it's okay. That's not that bad.
It's okay. Sometimes it feels better going up.
Yeah, this was more tender than.
Breathe. And on the exhale, push. Okay. Let me see what's going on. She's okay. Again. Yeah, when you breathe, it flexes the rib cage, so I can gain. It's almost like a barometer. It tells me how well I'm doing. Okay, here we go. Intense part. Oh my God. Just pop my back. There we go. Doing all right?
Mm-hmm.
Down the leg. Check the hamstrings. A little bit of tightness here. Not bad. This is bad. Okay, I'll try my elbow. If you can handle it, if you think you can.
Okay.
This is gonna take me some time. Pretty good over here. Pretty good, and then SI joint. Oh my goodness. Doing okay?
Mm-hmm.
If you need a break, you let me know.
Okay.
Oh my goodness. This one I'm gonna have to have you on your side. So, do you mind being on your side temporarily? Okay, come on and face me over here. Now I can see your face. Oh my goodness.
Yeah. That. Yeah.
Oh, the cluneal nerves are
Everything's
just
mad.
really like right in here. You just got an issue. See how I grab your leg and I'm like leaning over you? But see how I'm over here with my chest?
Yeah.
And I'm pushing.
Yeah. It
That's
gives
why-
you a good.
I can just, I don't
You
have
can
to use my arms.
Mhm.
I
All
can-
your body weight.
I'm like doing a plank on you guys. Yeah, there you go. And that one I'll have to get back when you're on your stomach, down the IT band. IT band feels fine. Okay, now to take out some of the spasm, I need you to lean back until I feel it. Yep, you can lean your head off the table, that's okay. Protect that neck. Oh man, you're flexible. There it goes. I think that's all it's gonna go. This one's a slightly different move. Okay, head back off the table though. I've got you. You're not gonna fall. I promise. I've got your whole body in my hands here. I've got you. Oh, you're so flexible. Does that hurt?
No.
There it is. Part of it. No, bottom leg straight though for me. That's as far as I want to take it. You're very flexible. And if I go further, I'm gonna get the lumbar spine.
Okay.
And I don't want the lumbar. I just want the SI joint.
Okay.
I'm doing just fine.
Okay. Yeah, this whole thing. Oh, I'm sorry. There it
No, you're
went.
fine.
There it went. Oh, I didn't warn you. I thought it was. I'm sorry.
Okay.
Usually I say, okay, now breathe, but that just like went right there. See, nice. I'm gonna use a star. Here we go. Good. check it, okay?
Mhm.
Yeah, there you go. Uh-oh. Whoops. Nope.
Kidding.
No, let's go back. Let's go back. Well, no, it's just one little piece left. There you go. Wow. Oh my goodness. Oh, that's the scar. Swollen, no scar tissue until there. Hear that little crunchy?
Mhm.
That's the scar tissue. Right there.
That's crazy.
It's like, it's just edema above it.
Mhm.
It's hard to stay on. Right there. Oh, goodness. Right there. Okay, I'll leave the low back alone now. This arm behind your back. Let's check underneath the scapula. Oh no, clean. Oh, that feels pretty good. No, left. That's all it's gonna go, I think. You definitely have like a little adhesion here.
Mhm.
Right here. And the elbow is just too much.
Yeah.
Like, I want to pull this down, you know, but if it's too much, it's too much, but it's this whole side. I think that's as much as I'm going to be able to move it. Yeah. Good. Okay, that's as far down as it goes. And how about up here? Is this done, you think? I mean,
I don't know.
it's pretty
It's
bad.
So tender.
It's really bad here. It's like, I don't know. The scraping might be all I can do.
Mhm.
You need a lot of this. You need to get it done more often.
Okay.
Let's see if that rib shows up. Oh yeah, it does. No way. I mean, look at that. You were right, you know? Listen to your clients. Listen to them. It doesn't mean they're always right, but like, you know, like go, okay, let me just look at it. Let me investigate it. Yeah, look at that. Right where she pointed in the beginning. I'm not really getting any petechiae out where the swelling is, you know, where the injury is. It's just right here where your ribs are. So this has been here a while. This has been here longer than 6 weeks, okay?
So it like comes back
this
and
thing.
goes away.
Okay.
And then comes back again and goes away.
Yeah, it's a problem that has never been addressed. So the way I do it is I kind of run it down the paraspinal muscles first.
Mm-hmm.
Again, this is not a tutorial for those watching, but it's just the way I like to do it. I run it down, without hitting the spinous processes. I see, and then I find one, and if it's okay, here's the spinous process. And if it's separated, if it's slightly away from the spinous process and it's into the TP, that's a rib. So now I'll go out and search for the rib. You know, it's stagnation. There's blood that's sitting in there. And you want to increase circulation to that area. And sorry, this is old school, but this is how you got to do it. So now I'm going in line with the rib. Check the paraspinal muscle again. It's like something wants to try to come out here. Wow, you were that bad.
And then after that, it had just killed my immune system. But I haven't been sick in a long time now. I can feel the heat.
Oh, that's done. You know what I mean? When you
Yeah.
feel that hotness, you don't go past that.
Yeah.
Because then it just, I feel like you can break it down too much,
Mhm.
and then you can actually cause a problem.
Mhm.
So when you get that heat, done. Okay, let's go up into the upper back. Lower the shoulder down as much as you can, but relax it now. That's it. And you can't go past that. It's like it's done.
Mm-hmm.
All right, put some more oil down. I never know. Oh, well, see, because this is superficial. You understand? Like, this is just the surface.
Mm-hmm.
And I feel like little grains of sand in there. And that's the beads of blood in the scar tissue. You don't want that. So, surprise, surprise. You have some over here. You know, when I'm using my elbow and everything, I am like super, super deep in there. I'm not paying attention to too much to what's going on the surface.
Mm-hmm.
I let this thing do that for me. And I guess I was kind of right. There's nothing really coming out. I could, try to lower it down, but so I can get into the meat of it there, but I mean, I'm trying to pull it out. It's just making you red.
Mm-hmm.
It's not really purple. Oh wait, I lied. All of a sudden, it wanted to cooperate. All right, now we're going to do the neck. Doing okay?
Mm-hmm.
I feel it down into here, though. That came out pretty quickly. This is like, ugh. Okay, let's take care of it then. Let's get rid of it. The thing is it's still there, and I think you're about tapped out. Am I hurting you?
No.
Ugh. Okay, I'm gonna stop there. Want to take a picture of it? It looks pretty gnarly. Let's see, there's no blood, you know.
No, I believe you. I was watching like how it was coming out on other people because I didn't understand how it worked at first, and I think
Does it make a little bit more sense now?
yes.
Why the bad areas are just more bruised?
Yes.
Okay.
I knew I was tight in my shoulders, but I didn't realize how tight and
it's
how
pretty
guarded
bad.
I was over here.
So.
Oh wow, that's crazy. Yeah, and there's like nothing on the lower back.
I tried. What you can't see here, I should probably take another picture of, is your ribs. Okay, that was your ribs there.
You can actually see the ribs.
Yeah.
That's crazy.
That was all I could pull out though.
That's
Like
crazy.
I couldn't pull them all out. They didn't all turn red. Just these were the ones that were scarred.
Yeah.
Remember I kept running down your back and I was like, oh, there's one, there's one. And that's usually where this will be.
That's wild. That's crazy.
Push your elbow back towards me. Good. Just testing them out. And then again, elbow back towards me. Good. So this one definitely has more range of motion.
For the wax spot, I turn a lot and they click and click and click.
The right one?
Sometimes both of them, but mostly this one. A lot more.
Yeah, this one is like, I think it's okay though. It is. I'm just gonna reach around and see if it's. No, it's all right. It's fine. It just feels good to be worked on. You work with your hands.
Mm-hmm.
Yep, lean away again. No, everything feels good. Feels like loose, everything's moving the way it should. Your ears, I'd like to check your ears.
Okay.
But lean away from me. There we go. Lean away. Oh, that's all I'm gonna do on that side. I'm like, I think it needs to just go. It's like a. So let's just go. Lean away. I don't feel it on this side. Nope, there's nothing there. So it's just this ear.
Usually if I just... Did you hear that?
Yeah.
It's weird. I don't know.
It's
I
just
tried
the
to look it up.
it's auricular cartilage.
Mhm.
It's okay. It's alright. Alright, how do you feel? Let's come on, stand up, and let's see the low back. It's still swollen as all get out. Okay, that's gonna take a few days to calm down.
Okay.
The left-hand side.
I feel good.
But how, go back.
I feel good.
Feels okay, nothing's
Mhm.
pulling. You sure?
Mm-hmm.
I'm gonna hyperextend you though.
Okay.
Because here we go. Alright, you don't have to film this part. Okay, any other questions? I'm doing a once over on.
I don't think so. I knew like it was my SI joint, especially because my psoas started spasming and I could feel it spasming and I knew it was.
I mean, I can go in there and
Orient.
pull it apart. Get your ribs moving.
Mhm.
People love to work here because it's easy.
Mm-hmm.
The ribs, if you don't get this big, bulky thing moving, it doesn't matter what you do down here. It's just going to keep wearing out.
Okay.
It's going to keep spasming in the front and being stretched out in the back. You have to open this up. Haven't you ever seen like the doorway poses where you that's like a baby one. I mean, I need you, you're 23, you
Yes.
can go back. Hell, if I can do it at 36, I mean, look, that's kind of sucks though. But do you understand?
It's better than what I
It's
could do
here,
right now.
but it's not in the low back. Okay, it's not here. I can go. I've got plenty of flexibility in my low back.
Mm-hmm.
It's the upper back, and I'm not warmed up, but this has to open. Okay, get the arms back with the ears,
Okay.
and go back, and then you can engage the here until you feel it stretch. You need to feel it up in here,
Mm-hmm.
and I don't know why. It's coming. It's coming. The science is coming.
I cannot wait. I think it was one of the most fascinating portions of massage therapy was myofascial release and stuff like that.
That's all this is.
And working the body into the position it was in when it got into the accident, all that stuff. You can listen to the fascia and it'll tell you.
Well, that is what I'm doing.
Mhm.
Why do you think I asked? How did it happen?
Yeah.
You put together the pieces. The fascia does talk to you, so that is what I'm doing.
Yeah.
You're not far off. In fact,
I love all the
I think
nerdy
you're
talk.
kind of there.
Yeah.
Yeah, you just have you have a bunch of ribs that aren't moving. Low back is hypermobile. SI joints are not moving the way they're supposed to. Okay, so your low back is the only thing healthy, and it ripped. It was the only thing that could move in that situation, and the weak area gave out first. So the only thing you can do to help that weak area heal is take the pressure off of it by getting the other pieces moving. So doing something, a backward bend like that. Yogis love to use their low back. Don't use your low back. It's your mid back, okay? SI joints. This has to be loosened up here. This has to be loosened up. I think you get it. I didn't do the calves and I didn't do other. You can do that. But you know, this rib cage was something that I knew you couldn't get yourself. This and this. So that's where I worked.